This is the December 8th meeting of the Sexual Assault Response Network Committee. We are coming to order with a quorum. I appreciate everybody being here this morning. Thank you so much. I'm Hope Stockwell, the Sexual Assault Response Network Program Coordinator and Facilitator for the committee. Just quickly, we have a few folks who have to jump off early, including Brett Irigoyen, who has a hearing at 10. And we are routinely scheduled to start with our member updates, but I wonder,
Oh, but
yeah. Good morning, Brett.
I don't have to. I got somebody to cover that for me, so I'll be
Oh,
here.
okay. Well, that
Can you
makes
hear me?
things. I sure can. Yep. Can you hear me?
Oh,
Okay.
yes.
Good
It's
deal.
just a delay, I think.
If the internet has to get all the way out to Miles or all the way out to Glendive, pardon me.
Yeah, it's a trek.
All right. Well, that makes things simpler then. I was going to suggest we flip some order of things in the meeting so that we could take advantage of the time that you were here, but we'll just go in order that we were anticipating then, starting with brief member updates on how things have been going for you, any updates you might have in your world of sexual assault response, or other information that you think would be good to share with the committee about things going on in your world, or if you've had any conversations with folks about the work that we're doing here and have anything you want to share with the committee. If you have anything like that, you can also share it during the course of the meeting, wherever you feel like it fits best. But I'll just start here, going top left across my screen. And Brenda, you are first. Good morning.
Oh, I wasn't prepared for this.
Pardon me.
Um, let's see what is going on in our world. I went to the county attorney conference, got to see Brett last week. And we are planning our children's justice conference, which is we have a great lineup for March and our 2026 training calendar. I haven't really talked to anybody or had any questions about this committee. So that's about all for my update.
Thanks for the heads up on that Children's Justice Training Conference, Brenda. Thank you. Ben, good morning.
Good morning. Um, Not a whole lot new for Holy Rosary or Miles City area. It's kind of been status quo. Just as you can see with the shirt, it's the Christmas kickoff celebration week for us here. So that's where it's there's lights. I shut them off so we don't have the lights going on right now for the meeting. But other than that, it's pretty not a whole lot new here for Holy Rosary.
All right. Good morning, Sergeant Darian. You are next.
Not a whole lot on our end. We have a lot of like internal changes at our agency going on. So just kind of working on that, but I haven't had too much as far as this SARN committee stuff.
Thank you. Jamie, you are next.
Good morning. Not too much going. Well, actually, that's not true. There's always something going on at the crime lab, but one of our new DNA analysts is started. She started in October and she's working through the training, so she'll be probably going on some of the casework probably beginning of February. And then we have a new DNA analyst and a new serologist that are starting January 26th. The serologist is coming from Phoenix, and she was previously a serologist at the City of Phoenix Crime Lab, so she should be up and running pretty quickly. But yeah, we're looking forward to some additional help and just enjoying the holiday season.
That's great news. Thanks for sharing. Emily, Mangus.
No big updates in my area. And I don't think I've talked to anybody about the committee work in the recent past.
Very well. Good morning. Brett, you're going.
Well, I feel underdressed compared to Ben, but yeah, we had our county attorney convention last week. went well. We discussed the legislation we're going to be talking about today at the board meeting, so I'll give kind of thoughts on that then. But yeah, same stuff here. Yeah, got unfortunately more sexual assault cases that I'm prosecuting than I would like, but that's the business.
Yeah. Well, we appreciate your work. Your audio is a little disjointed this morning. I don't know if
Yeah, I keep getting a notice that I've got network connection issues, so I'm not sure what the problem is. If it continues, I might drop off and try to reconnect and see if that.
another option might be to just turn off your camera and see if that helps with the bandwidth for you. Yeah, Ben's sweater is exceptional today, I gotta be honest. So, Whitney, you are next.
Hi. Think nothing super exciting. I honestly I really like this group and I feel really comfortable saying this. I'm just really feeling defeated in our work this month, especially this morning. I came to work with some unfortunate emails from some people in our community. And so I'm really frustrated and struggling with that. But then I saw Ben's sweater and that brought a smile to my face. So I'm going to channel that Christmas energy and turn down my email and ignore it. So thank you. And I guess I have talked about committee stuff to our sexual assault response meeting or our team. We had some meeting last week. So I talked about some stuff and yeah, they all are really excited to see what happens.
Yeah. Well, thanks for sharing where you are, Whitney. And Ben, in response, has put on his extra cheer.
Yes. I'll put on my hat. There's a little Santa on top too. So just to get a little bit extra cheer for you guys.
Reminds me of Will Ferrell and Elf, quite honestly. So that's what I'm thinking about right now. If you're wearing yellow pants, I don't want to know.
Nope.
Celine, you are next.
Good morning, everybody. I don't really have an update other than it is a Monday in my world. And when I was signing on to the meeting, I managed to drop an entire cup of coffee on my carpeted office floor. So I will be cleaning that up here in just a second because it's driving me nuts and I can't believe I did it.
Sorry. Hang in there. Jordan, you're next.
No update from me. I'm just glad I could be here.
Thank you. We're glad to have you. Mark?
Hi. Yeah, not really much to update here. Just the government shutdown wreaked a lot of havoc with virtual appointments, and unfortunately, our next deadline is January 30th. So we'll see if it happens again. Otherwise, I didn't spill coffee, but I don't have a cool sweater. So that's my update.
Ben's really challenging us for our next meeting. We might have to have our own ugly sweater contest on Zoom at some point for a little festivity. Brett Taylor, you're next.
Not really much from my side, unless you want to hear about boring IT stuff. Although I didn't spill my coffee and I have a Be Kind cup here.
Very nice. Very nice. Well, we're glad to have you. And then let's see. I think I got all of the committee. Oh, Christina. Christina Powell is with us. She's not able to turn on her camera today, but she is here. Go ahead, Christina.
Hi guys, I'm so happy to hear that your Monday is the Monday. So very happy to be with you people.
We are glad to have you too. All right. I'm going to start with DOJ folks next and just see if there's any particular updates anybody wants to share. On my end, as I let the team here think about what they might want to say, we have been working in partnership with the Montana Board of Crime Control and the Department of Corrections and the Department of Public Health and Human Services to think about future trainings for prosecutors and law enforcement. And so we are working together to see what we can put together for a May opportunity in 2026. So I'm excited to be working with those collaborators around state agencies on that effort and working on this draft legislation, which I look forward to those conversations today to see what you all think about that and where we might take the conversations. So let's see, Suzanne, I'll go to you next.
Good morning. I am no update specifically for me, just helping out Hope in whatever way I can and providing support for her and forwarding information up through the management chain. So that's about it on my end.
We appreciate it. It's always very helpful. And Derek, you are next, if you're able to join at the moment. I'm going to call on Emily and see if she's got anything she'd like to add at the moment. Emily Cantrell.
Sorry, no updates on my end. I'm just on the road travel today, so I won't be chiming in too much.
We appreciate you being here to listen, Derek. Thank you very much. And just as a reminder, Derek's our bureau chief in the Investigations Bureau. And Emily, I saw your microphone open there. Did you want to touch base? I can't hear you, though. Looks like your microphone was open. Still cannot hear you. Let's see. Okay, we will see if we can hear Emily in a bit. And Sue Parker sent me a message. She is trying to get into the meeting and needs help with that link. I'm just going to shoot that to her again. All right. Emily's having a tough time with her audio. Emily, if you want to, I don't know if logging out and coming back in would help or not, but it might be one more thing to try. Otherwise, we can team up on a break and see if we can get it to work then. Okay, our next discussion point this morning. Anything else from anybody before we get started on discussing the minor consent for sexual assault forensic exams? Okay. I'll just say for public members attending, we will have public comment after we review the draft language change options that were posted on the SARN committee's website. If you have not seen those, please do Google Montana SARN committee, SARN, and those draft proposals are linked on the committee's webpage under the December 8 meeting information. So you can open those up and look through with the committee as we go. We will, after the committee reviews the language, take an opportunity for public comment and then have more committee questions and discussion. The options on the table today, everyone, are anything that you can think of. One, if you'd like to make further changes to a proposal to come back at a future meeting and look at again. If you'd like to move discussion forward on a proposal as is. If you would like to not move it forward and let it go. If you'd like to propose something else, whole cloth, there are lots of options on the table depending on what your thoughts are today. So I just want to lay that foundation as we get into this conversation. We do have it noticed on our agenda today that if the committee wants to take action to move something forward, that is something that's been on the public notice. And so the public was made aware that that was potential for action today. That's just a formality so that people are aware that that could happen. All right, so I'm going to share my screen with the first proposal, the minor consent for care. Should be seeing that now. Can I get a thumbs up that it's coming through? Great. Okay. So this draft came out of the discussion that you had at your last meeting in your specific request to see an update on this topic related to statutory language allowing minors to self-consent to healthcare services. There are certain things existing in statute, and this specific statute, 41-1-402, that they can consent for their own health care under certain circumstances. The existing circumstances include if the minor is married or has a child or has graduated from high school, if they're found to be separated from their parent or legal guardians for whatever reason and are self-supporting, if they're found to be pregnant or profess to be pregnant or afflicted with any reportable communicable disease, including sexually transmitted diseases or drug and substance abuse, including alcohol. The other existing circumstances, if they need emergency care, including transfusions to prevent serious injury or harm to the minor. So as I looked through the existing statutes after our last meeting and your interest in adding language to allow minors to consent on their own for sexual assault healthcare response, it seemed to make sense to mimic the existing language in law. And so I started this new subsection in this same statute rather than create a new statute that a minor may consent. So it builds off the beginning of subsection 2, which says the consent to the provision of health services and to control access to protected healthcare information by a healthcare facility or to the performance of health services by a health professional may be given by a minor when the health professional, in good faith and with a reasonable belief supported by fact, determines that the minor meets any of the following descriptions. And I added to this section a new subsection E, that the minor professes to be or is found to be a victim of sexual intercourse without consent, sexual assault, or incest, which are the primary crimes related to sexual assault in statute. These are the crimes that are listed, for instance, in the forensic exam statute, and payment reimbursement for those exams. The new subsection goes on to say, self-consent under these circumstances also obliges the health professional, if the health professional accepts the responsibility for treatment, to counsel the minor or to refer the minor to another health professional for counseling. This mimics the existing language in the subsection up here. When a minor professes or is found to be afflicted with a reportable communicable disease or drug or substance abuse, that language is also here. And so it seemed to make sense to mimic that here. This is something you can say if you want to go forward with this. That doesn't make sense to us. We don't want to include that. This is really just a first draft to help you think about how you want to shape this. And then the last sentence in the new subsection is the point of conversation that you all had about parental notification, which is the parents, or legal guardian must be informed as soon as practical, except under the circumstances mentioned in this subsection 2, or if the parents, or legal guardian is the suspected perpetrator, which I believe it was Kansas, and I'm forgetting the other state that Brett Irigoyen specifically had mentioned in our last meeting, as wanting to leave that option there. For that notification. The first part of that sentence of the parents, or legal guardian must be informed as soon as practical, except under the circumstances mentioned in this subsection 2, which means those cases in which the minor can self-consent to care. That language is also mimicking from this subsection D that already exists in statute related to emergency care. You'll see that same language there. So oftentimes when drafting legislation, it makes a lot of sense to mimic the existing language, and that's why subsection E is drafted as it is. But any questions or comments on that from the committee to help you understand the language or thoughts you have right now on it? Yeah, Brenda?
Thanks. So this would be for the attorneys, really. The part about is found to be a victim. So I'm not clear, like who would find them a victim? Usually, I don't know, if a case goes through the criminal justice system, someone's convicted, but I just would wonder who would be the one to found. And then my second question would be whose responsibility is it to notify the parents? Is it does this infer the healthcare provider? So those would just be my two questions. And I'm not the legislative expert, so.
Celine or Brett, you want to take the first response there?
Yeah, the or is found was something that I had noted as well. I think that that's referencing found to be by the medical professional that's taking the intake from the individual. Um, I think we could probably have it without language in there. Just the minor professes to be a victim of sexual intercourse without consent, sexual assault or incest. Um, so that's my thoughts on that part. The second part, yeah, it would be the medical professional that has to make contact with the victim. That's how it was in each of the other statutes we looked at from different surrounding states, anyway. Um, and it may be law enforcement, if they're a mandatory reporter, obviously, that would be making that contact on their behalf. But I think the onus is on the healthcare professional, at least initially. Celine, let me know if you have a different.
Yeah. Given I was trying to think through different circumstances here, but this is in the circumstance of a minor seeking care on their own. Guess I was trying to like come up with a situation where we would need that found to be like found by a medical provider kind of language. But I'm blanking right now, probably because my coffee's on the floor and my brain's not awake. I I mean, the thing about the legislative process is um everything changes, right? So we could leave it in and have more of a group think that way, or we could remove it for now and always add it later if something comes up, is kind of like where my brain is at right now. I think it would be okay to remove it because there's not like a test, like a pregnancy test, that a victim would be found to be sexually assaulted. Um, so I think it would be okay to remove.
Whitney and Sergeant Gadarian have their hands up. Whitney?
Yeah, I was just gonna say on the found part, it's like different than a pregnancy test or a sexually transmitted infection. There's no like positive, negative test. And then my other thing was these sexual assault exams in Montana are happening within 120 hours, and we know that, to be found guilty of or like that this person was sexually assaulted through the law enforcement and prosecution is not happening within that time frame. And so that makes me a little nervous. And then to have that in there. And then I think it would make sense that the healthcare provider has to attempt to notify the I'm sorry, I was trying to read it. Notify the parent or legal guardian. I two things that I like. I like that you kept minor without a specific age. I think that is really helpful. And then you kept the time frame of notifying parents as soon as practical. also kind of vaguer. I don't know if vaguer is the right word, but not like within 24 hours or 48, like a specific time frame. So those are the things that I liked about it.
And Sergeant Godarian.
Yeah, I think that I don't like the found word either. I think suspected might be a better word. Like is suspected to be a victim. I think that if we take it out completely, if you just put the minor professes, well, sometimes the children don't disclose. And like the investigation starts prior to them disclosing. So I think it would sound good to put suspected, but I don't know what your guys' thoughts are in there.
I think that's a great point, Kara.
Other comments or questions from the committee before we go to public comment? And then we can have more committee discussion too. Yeah, Emily Mangus.
I agree with Whitney around the attempt to notify versus must notify. Um, I also struggle with there may be a certain percentage of the patient population that as soon as they say we have to attempt to notify your parents that you're here, that they will stop wanting care. I do think that the language here allows us to see more patients without parental consent on the forefront, and it'll allow us to be able to continue to see those patients in our communities rather than having to find communities that are working through different like loopholes or interpretations at this point in time. But I think it should be rather than a must, will attempt to notify.
Any other thoughts on that at this time?
I I think I would agree with that. Sometimes we can't notify parents as law enforcement, so I can't imagine like how hard it is to locate or notify some parents. So I think that that would also not give an out, but give an understanding. If we must notify them, then I think shall attempt is better wording.
Or maybe should we try must attempt to keep with the must wording of
Well,
verification?
this is a bill drafting construct. The options when you're using a person as the noun are
Mhm.
may or shall. So it either needs to be may attempt or shall attempt. And I think the shall attempt is going to be what a legislative body would be more interested in.
Yep, I agree.
I think attempt modifies the shall in the way that y'all are looking for. Are there comments before we take public comment? Okay, I'm going to move to public comment then. As a reminder for those attending today, please click on the raise hand button at the bottom of your screen now to indicate that you would like to make public comment on this particular proposal or related to minor consent to healthcare services after sexual assault response. That is what that public comment option right now is limited to. There is a general public comment option later on the agenda for anything under the committee's purview that has not otherwise been discussed on the agenda today. So if you do have comment you'd like to make at this time, please raise your hand. And when you do, I will ask you to identify yourself indicate whether or not you represent an organization other than yourself, and you may make your comment at that time. I'm not seeing any hands raised at this moment. Oh, Celine, I'm going to give it just a little bit longer here. Make sure one more call for any public comment on the draft proposal related to minor consent for sexual assault healthcare. All right, seeing none. Celine?
Yeah, this is probably in the weeds a little bit, but I was thinking about that second part of this sentence, right? That the parents, or legal guardian must be informed as soon as practical, except under the circumstances mentioned in this subsection 2. And I'm thinking from like a legislative, like an interpretation kind of, like statutory interpretation kind of mindset. Because this is in subsection 2, does that negate the parent or legal guardian must be informed? Or should it say something about except under the other circumstances mentioned in subsection 2? Do you see what I'm saying, Hope?
Hmm? Yeah, I do. Yeah, so that mimics the same language here, which is the reason I wrote it that way, but I see your point, and I think we could change it to say except under the other circumstances.
Yeah, and I mean, just because something was written once doesn't mean that it was
Yeah.
perfect the first time. But
Mm-hmm.
like if I were trying to defend a hospital or law enforcement that hadn't notified, like that potentially is a loophole that makes the notification a little iffy. And I do think we want to at least attempt the notification to get as many legislators on board as possible.
Mm-hmm. Okay, I added that other there. Is that where you were thinking, Celine? Does that match up with what you were? Zoom in a little.
Yeah. Yep.
Okay.
I don't know, Brett, if you want to take a look at that too, and at some point. It's what I found working with the legislature. It's hard to think about all of these weird loophole language things. So this is like, in my opinion, should be an ongoing process. And I guess I would just voice right now that I don't know that we should move it forward today. I think we should all have a little bit more time to sit with it and try to think through some of those weird circumstances that we'd all be familiar with. Is just my 2 cents on that.
Yeah,
Emily Cantrell. Emily Cantrell.
I think can you hear me?
We can. Yep.
Okay, I was just gonna kind of say like a little bit to what Celine was saying. I don't think you guys have to decide for sure today or even this week or this month what the legislation is gonna be. Because from our angle in the AG's office, and regarding whether we'll support or what it'll end up looking like here, like we're still working through a lot of other legislation ourselves. So I would recommend like taking some time looking at it and not deciding, not feeling like you have to decide right now.
Yep. Agreed. Agreed. And you might also consider, with other committees that I've worked with in the past, if they propose legislation, they would put it out for a formal public comment period of 30 days, and then come back at a future meeting to review any comments received. So that could be an opportunity you also could consider. Brett Irigoyen?
yeah, I was just gonna say I understand what Celine's saying there. I don't know what the best way to word that is. I realize that mirrors with sub D there. The one thing that I did think when I read through this the first couple times was it may behoove us to put if the parents, or legal guardians is a suspected perpetrator first in order of those two. So put that first, and then except if the parents, or legal guardian is a suspected perpetrator, or under the circumstances mentioned in subsection 2. Because I think the more important point for this subsection is that we want to make sure there's no notification requirement if the parent is the perpetrator. So I like that coming first, as opposed to referencing the other subsections.
I like that, Brett.
Other comments or discussion on this one? Well, do you want to let this sit where this is right here and move on to the other proposal and just expedite our agenda here, and then we can come back after discussion on the other proposal and return to this if anybody has other comments or discussion on the language? Okay, I'm seeing head nods. Stop sharing that proposal. And we're now going to move into discussion of the sexual assault forensic exam payments and start with a review of that draft proposal. So I put this together as food for thought in a bit of an expanded fashion from what you originally proposed. And the expanded fashion is that the title is a little bit broader here. Revising laws related to sexual assault medical forensic examinations. That captures making the changes to the statute related to how exams are paid for, but with two additional things. One is redefining what sexual assault forensic exam is or means. The original statutes adopted in 2023 referred to sexual assault nurse examiners and not forensic examiners more broadly, to include, for instance, physician's assistants and physicians who are also doing these exams. And so it seems like if the committee wants to move forward in the future with, for instance, adopting best practice guidelines for medical response, it could be useful to broaden that term, because currently your authority is limited to sexual assault nurse examiners potentially, although you could maybe argue how the rulemaking authority you have is written does give you broader authority. But redefining this to be all forensic examiners and not just nurse examiners might clarify that. So if you wanted to take an opportunity with a proposal to do that, you could. You don't have to. I'd put it in here as food for thought as I was working through the draft on the forensic exam payments. The other thing that I included is a cleanup on the statutory requirement for how long evidence is held. The 2023 legislature changed it to 75 years from 1 year. And there are actually two statutes that talk about that, and they missed cleaning up the other statute. And so there's another statute that says 1 year instead of 75 years. And it seems like this could be an opportunity to clean that up at the same time. You could choose not to do that, or you could choose to do that in a separate, smaller piece of legislation that just goes in and strikes that section only. I'm just bringing it up as food for thought as we talk about the broader payment structure. So I'll point those out as we go through, but I'll start first with talking about the construct of revisions to the payment structure in this proposal. This proposal mimics a lot of Senate Bill 491, which was proposed by Senator Phelan in the 2025 session. It starts with the construction of a sexual assault medical forensic examination fund, into which the monies to be used to pay for exams would be put and transferred into, and then the Department of Justice would have the authority to use the money in the account that's appropriated for such uses to pay for the exams. In subsection 1, it does say we need to indicate here, what are we using for the funding source? Senate Bill 491 and Senate Bill 537 last session had looked at marijuana revenue as the funding source. But you could also choose to indicate state general fund monies in the appropriation. That's a point of discussion here for the committee to have, how you want to move that forward. The fund was built much like Senate Bill 491 was amended so that it would be allowed to also be used to purchase and distribute sexual assault evidence kits, which we do not currently have a dedicated budget for. We have been using the Office of Victim Services Crime Victim Compensation budget to pay for those kits and distribute them. Subsection B would allow money in the fund to be used for exams. And this is written so that it's broadly interpreted. It doesn't matter whether it is a kit is collected, for instance. It leaves that open for consideration. It also allows for the funds to be used for maintaining and establishing a secure electronic system by which the reimbursement requests can be made by healthcare facilities, which would help streamline the work on this side of the equation in the back end. And then included language that the money in the account may be used also by the department to train sexual assault forensic examiners, as we don't have a dedicated funding source for that at this time. And this is, I think, the way it would be implemented would be exams would be paid first. And if there was money left over, then that could be used to train examiners if there was money available. So again, food for thought. You don't have to choose to move this forward. It was just something I included for you to look at and think about. The last subsection for the account is that interest and income earned on the account and any unspent or unencumbered money in the account at the end of a fiscal year remains in the account. Without that language, the money gets swept back into the general fund at some point under typical state accounting practices. If you wanted to include marijuana funds as the source of funding for the account, I've included 16-12-111 for your consideration. It lays out how revenue from marijuana taxes are dispersed. And so it has a whole list of things that some of those monies already are dedicated to, and then would take another percent of what's left and dedicate it to that sexual assault medical forensic exam account. I noted in the comments section of the document that Senate Bill 537 in 2023, when it looked at doing this, it set aside 1.5% of the marijuana revenue, and that fiscal note for that legislation estimated that allocation would amount to $832,000 in fiscal year 2026, to give you a ballpark of what that calculation could be. That would be money, the way that this is set up, it would not come out of any other percent that's already dedicated to another purpose. This would be a percent taken out of the balance of the money that instead goes into the state general fund. So it would be siphoning off another piece before it goes to the state general fund, the way that this is set up in this draft. And that's also the way the Senate Bill 537 set it up. Moving on here, the next sections are updating those definitions of sexual assault nurse examiner to sexual assault forensic examiner, as well as telesafe to be all forensic exams, not just nurse exams. Same thing with 44.4.1702, updating those definitions and the terms that are used to make that more broad. And then in 44.4.1703, same thing with updating those terms. But then this is also where your current rulemaking authority lies for establishing and periodically reviewing the payment amounts and the processes for sexual assault medical forensic examinations. So it seems potentially a good idea to update your rulemaking authority to make it clear what it is you're asked to do, particularly in light of your interest in including an inflationary adjustment, to make the statute specifically say that that is something that you need to consider in whatever structure you implement with your rulemaking authority. This is kind of getting into that discussion of how much detail in the exam payment structure do you put into statute, or do you just do the broad strokes and then leave it to your administrative rulemaking process to work out the fine details so you have more flexibility to come back and change them if you need to adjust them in the future? It could be easier to do that in a rulemaking process instead of going through a legislative session again to update the statute. So the way this would read is that your rulemaking authority would include establishing and periodically reviewing payment amounts, eligible services, and reimbursement processes for the sexual assault medical forensic examinations in accordance with 4615.411, which is the statute that says who is responsible for paying. We'll get into that coming up here. The second sentence here that's added would say, when establishing payment amounts, the committee shall include an annual adjustment based on any change to the consumer price index for all urban consumers from the previous year. The adjusted payment amount must be rounded down to the nearest dollar. That's language I've seen elsewhere in statute and just pulled into this to mimic the way those CPI adjustments are already mentioned in other statutes. Please stop me at any time or ask questions if you need to as we go along. This next amendment, 44.7-303, this is just removing this old reference to a different fund where there's a reference to paying out of it for these exams. It is our understanding this has never been used. This amendment to this section was also included in Senate Bill 491 last session when it was seeking to change how exams are paid for. Here in 4615.404, this is that cleanup piece that I mentioned about making sure that the evidence retention requirements match. This is the statute that was left behind and not updated when the legislature changed in 2023 to require evidence kits to be held for 75 years. So this would come in and clean that up. We recently had some stakeholders that were confused about the retention period, whether it was 1 or 75 years, and whether someone could argue that it really should only be 1. And so wanted to bring this forward to see if you would consider cleaning that up so that it matches. And then we get into 4615.411, which is where we currently have the split between law enforcement paying for exams that are their responsibility if they use the kit for the investigation, prosecution, or resolution of an offense, and the Department of Justice paying in other circumstances. And this would create a single payer system so that the Department of Justice shall use funds from the sexual assault medical forensic exam account established in Section 1 to pay for sexual assault medical forensic exams of a victim of an alleged incident of sexual intercourse without consent, sexual assault, or incest, conducted in accordance with any rules adopted by the committee, regardless of whether a sexual assault evidence kit is collected or submitted to a law enforcement agency. So that would be specific to leave the door open to paying for exams when a kit is not collected, and also anonymous kits, so they could still come to be held by us here through the Forensic Rape Examination Payment Program. And then it leaves in this piece here that this section does not require the state to pay any cost of treatment for injuries resulting from the alleged offense, which I think is in your purview. If you do want to propose changing that, that would be a bigger price tag and a different budget discussion. But it is your prerogative if you want to have us consider that. So I'll throw that out there, but I did not make any changes to that provision in this draft. The other things that are struck here in these subsections are really about its language that previously said or currently says the department shall identify priorities for funding services, activities, and criteria for the receipt of these exam payment funds. The department shall monitor the expenditure of the funds by organizations receiving the funds, which I don't think we've ever done. The department would evaluate the effectiveness of services and activities under this section and adopt rules necessary to implement this section. And by striking this and updating the committee's rulemaking language in the previous section, I think that brings some clarity to it being the committee's role to undertake these things, adopt the rules, and consider what's eligible for payment. The last sections here are just updating these internal references that need to be updated with the changes that are occurring elsewhere in the draft, and then including an appropriations section, which we could tackle this in a couple of ways. If this comes as a bill that is also a collaborative bill with the Department of Justice and brought through the department's budgetary process, you could marry up the budget request with the bill that way, or you can include this appropriation section here, which I think I would recommend, but I would defer to other greater minds in the department about what's best with that as things progress in the conversations. But typically you would include an appropriation section, I think, and decide what amount you wanted to appropriate. We can talk more about that in the Excel sheet with that exam payment calculator I sent you this morning. But that's where we would do that, is to add an appropriation section, and then include language that the legislature intends the appropriation to be considered part of the ongoing base for the next legislative session, to be clear that it's not a one-time only appropriation, but should be included in future budget proposals. And then include a notification to tribal governments and instructions on where this gets codified in statute, as well as the effective date. The bill would be effective July 1st, 2025, which would be the new fiscal year. Pardon me, that's wrong, 2027, which would be the new fiscal year, except that Section 2, which is the marijuana revenue, if you chose to use that as your funding source, would be effective on passage and approval because of the way that those disbursements are made. If the marijuana revenue section is also effective July 1, 2027, you miss the disbursement that happens at the end of June 2027. And you'd have to wait to have any money to pay for exams until June of 2028, which would be a terrible mismatch in sync of when the department would start to be responsible for paying for all exams and actually have money available to do it. There'd be a lag of about a year. That was a point of conversation that came up in the 2025 session. So I would really recommend these two effective dates, so that revenue money, if you choose to use the marijuana funds, would be effective for that first disbursement right ahead of the new fiscal year. And then included an applicability section here so that this applies to proceedings begun on or after the effective date of this act. It would not be able to be used for exams in the past. It would be exams going forward. So, questions? Comments? Emily?
I like a lot of the things that were done. I really like the fact that you went through and cleaned up so much of that language in terms of changing sane to safe, because I do think we've got a lot of partners out there that are beyond the scope of nursing that are doing the work and they should be included. I like the fact that you included changing that 1 year to 75 years where it was previously missed. And then the language to be able to increase annually. I liked having that in there as well. I had a couple of questions previously. There had been some discussion about maybe part of the reason why things didn't pass is because it was included in the marijuana fund. Is there any like, or marijuana tax money, is there any concern about that being an issue again if we were to use those resources? And then this may be a little tangential, but previously there'd been discussion about maybe being able to utilize crime victims comp funds for paying for some of those additional interventions like CTs without reporting to law enforcement. Is that going through the DOJ at all as part of your conversations for the 2027 legislature?
Let me start with that piece, and I'm going to ask Suzanne if she can chime in. As I understood it, that part, Emily, was dependent on federal rulemaking changes, and that has been sidelined. But Suzanne, do you have any other information related to that?
I don't have information specifically on the federal side. I do know that our crime victim compensation funds are pretty limited. And it is something that I'm potentially looking at for the next session. But I don't know what the ins and outs of the federal piece would be. I'd have to look more into that.
And then related to the marijuana fund concerns, thinking back to last session, Emily, when Senate Bill 491 had its first hearing in the Senate Judiciary Committee, that was a concern that was raised. And as things progressed through the session, and it was understood that the marijuana fund portion that both Senate Bill 491 and Senate Bill 537 was talking about did not take away from other priorities that had already been allocated marijuana funds, when people understood that it was from the portion that goes to the state general fund. I had legislators tell me, and they changed their votes and said this was why they changed their vote, was they now understood that money came from the general pool of money that would go to the state general fund and not other priorities that were previously identified, and that their comfort level was fine once they understood that. I don't know if that'd be the same this time. What I heard most in the House Appropriations Committee, which was the last hearing on Senate Bill 491, was that there had not been enough communication in different ways about this being an issue that needed resolved. Legislators on the committee expressed that they had not heard from people either in healthcare or law enforcement or elsewhere that this was a concern about the exam payment structure. And so we had two anecdotes to offer, and that was not compelling enough for them. And also because it had not come through discussion in the department's budgetary proposal through the earlier subcommittee process. That there seemed to be interest in seeing it come through the department's budget process. So. Emily Cantrell?
I was just gonna add a little bit because I know you and Suzanne and I have had like some conversations of whether or not these would be like DOJ agency bills or if these bills would be brought by the committee. And those are some of the things that we want to work through. And you like kind of touched on it. Would this like funding be brought through the department's budget, or would we do something separate? So we are definitely interested in working with you guys, but we're at the very beginning of our like legislative process, so it's just too soon for us to say what we I guess would even recommend at this time because we are looking at, 8 different divisions and what we're going to be asking for and that type of thing. But these are some questions, and I appreciate this conversation because it kind of sheds some light and can, I think, help us move forward in a good direction. I don't know if that helps or not, but
I think it's a great context. Thank you for sharing that. Other comments, questions? We can also move into the public comment portion. Let's go ahead and move into public comment and see if there are any. At this time, I'll remind the public attending the meeting that if you'd like to make comment on this proposal specific to sexual assault forensic exam payments or anything related to those payments, please click the raise hand button at the bottom of your screen at this time, and you'll be asked to identify yourself and whether you represent an organization other than yourself. Okay, no hands being raised at this time. Other committee discussion questions? I heard Emily Mangus say that she liked having the broader concepts included with the evidence retention being clarified and standardized, and then also the change of the terms from sane to safe. Are others interested in that, in keeping that going forward? See Ben nodding his head. I think I saw Whitney nod her head. Sergeant Gadarian, Brenda. Okay. Is there anybody uncomfortable with that? Brenda?
Well, the only thing is that telesafe is and this is again, I'll defer to the attorneys. Is it almost like not a term of art, but it's what New York system is called? So especially the way you have it written with the safe all uppercase, I just didn't know if it would make any reference to another state's program by terming it that. And again, I would defer to the bright legal minds on our group.
Celine or Brett Aragoin, do you want to?
I don't, yeah, I think it's fine the way it is. I mean, it's kind of a new term of art, really, at least within our state. So, I mean, I think it's fine the way it's written. I think we need the safe capitalized all the way through to be um, consistent with it, with everything else that we have. Um, so I don't see a problem with it as is, I guess.
I I don't think there will be an issue either. I agree with.
And Brenda, I think that um, the way that this is defined, it doesn't refer to another state's program or an existing program. And that would be the definition that would be relied on. You know, if this said, you know, X state's telesafe program, that would be a different story. So
Thank you. There's theirs is telesafe.org. So I just wanted to bring it up for the legal minds to weigh in. So thank you guys.
other discussion or questions? Okay. Do you want to take a 5-minute break and then come back and think about where or if we want to go from here? Okay. So let's come back together at 10:15. We'll take a brief pause. All right, we'll bring the Sexual Assault Response Network Committee back to order. Well, between the two proposals here, has anybody had any enlightening thoughts there in the last 5 minutes? Other questions that come to mind? One thought, we've been having conversation here about funding for other types of sexual assault response training, to give a more secure funding source for training, not only for examiners, but also prosecutors and law enforcement and victim advocates. Would we want to consider changing the language of that account so that the funds could be used for those other types of trainings as well, not just examiners? It would give us the flexibility, not make it a requirement, but as funding was available, to think that. Yeah, Whitney.
What if you kind of did it as like a rotating basis, like 1 year's examiners, 1 year's law enforcement, 1 year's prosecutors? That might be something that kind of allows, if funding's available, for everyone to get some training at least every, I don't know, 3 years, but could be more if we had different professionals in there. But the ones that come to my mind are examiners, prosecutors, and law enforcement, and advocates. So every 4 years.
Yeah, I think you wouldn't have to get that specific in the statutory language, but that could be an implementation consideration. But just making the statutory language broad enough to allow for those other purposes, if money was available. Emily Cantrell.
One thing I think that would be helpful, and maybe this is in the spreadsheet that you sent, I haven't had a chance to look at it yet, but one thing that might be helpful for our office is that dollar amount that we would be looking at. So I don't know, not that we have to decide that today, but it might be a good next step to kind of figure out what that would be, because that would probably be the most helpful part for us going forward in at DOJ as a whole.
Yeah, that's a great point, and that's a great transition. Thank you. I need to pull up this spreadsheet and share this with you all. So this I just emailed about 15 minutes in advance of the meeting this morning. I'm sorry I didn't get it to you sooner. So this is what we looked at last time, but updated. So last time we looked at this spreadsheet as sort of a calculator to help think ballpark about how much money we might be talking about here if we started looking at changing the reimbursement rates. And I ran calculations using the last couple of years to prognosticate how many exams we might have with evidence kits collected in the future per year, but also then taking the healthcare survey data that was given back to us about how many exams facilities are doing when a kit is not collected. So I used those to come up with these numbers in column B, and then ran the numbers based on our current structure, where we're only through the FREP program paying for kits that are anonymous and sent to us, and we're paying for them at $600 per exam, and we're only paying for an exam when a kit is collected. So that's what column C is. Column D was when we looked at expanding that to the state being a single payer system, and we're paying $600 for all exams, including exams where a kit is not collected. And then we looked at a single payer system where it was a cost of $1,000 being reimbursed for exams where a kit was collected and $800 for exams when a kit was not collected. And that was based on the napkin math that we had used for our fiscal note work in the 25 session on Senate Bill 491 and proposing what a dollar amount might realistically be. And that had got us to about $800,000 per year based on $1,000 per kit when a kit was collected and 800 when a kit was not collected. I'm going to freeze my top row here. So I took those numbers and I ran them forward. And just as an update in 2025, our current year, we're still on track to have about 462 kits collected this year. That held up with the most current data I ran as of this morning from KitTrack. And that puts us in our current structure if we paid for all kits that are currently collected instead of law enforcement paying. We'd be at about $277,000 at a cost to DOJ, and that would not include any exams where a kit was not collected. If we take that forward into, I extrapolated the percent change. So 2024, we had about 15%, 16% more kits collected than in 2023. This year, we're right on track for about 15% again over 2024. So I just used that to carry forward and anticipating or estimating how many kits might be collected in subsequent years. And there's probably a point at which that plateaus. I don't know when that is, but I just went ahead and applied a 15% increase in kits collected in 26, 27, 28, and 29 to look at where that put us budget-wise in these different scenarios. Excuse me. And where I came out, if we paid, DOJ was the single payer, and we paid only for kits collected in 2029, we'd be at $484,000 for the year. If we paid for kits collected and exams where a kit was not collected, we'd be just under $800,000 at a $600 reimbursement rate per exam. If we upped it to $1,000 a kit or $800 when a kit was not collected that year, and again, this is kind of rough numbers, especially for those exams without a kit collected, we'd be at about $1.2 million. And just as a reminder, that 1.5% of marijuana fund allocation in the fiscal note for Senate Bill 537 in 2026 was around $844,000. That number went up through time to more than $900,000 per year based on the Department of Revenue's projections for marijuana fund collection. So a little hard to say, but you know, we might start to price out here if we stay at that 1.5%. And if we were to increase for $1,000 per kit collected and $800 for an exam without a kit, and that's potentially just in 2029. So to give you a sense, I did do, when we talked last meeting, we also looked at North Dakota with $700 per kit collected and $400 without a kit collected. That still keeps us in budget here. Utah was more expensive with $1,250 per kit collected and $625 without a kit collected. That's pricier. And this was just this was allowing us to plug in other numbers if we wanted to. So disregard column H for now. These are built on column E, but are here for us if we wanted to propose other dollar amounts. I could quickly calculate that. So you see that North Dakota rate, it's a little bit more than we're paying now, keeps us in that 1.5% marijuana funding range a little longer. Any thoughts on that? Or if anybody's had reflections on the reimbursement amount that you might be interested in between last meeting and this meeting? Emily Mangus.
I like column E and column G. They bring us a little bit closer to like what our costs are when we think about it as a healthcare system for reimbursement and making things maybe a little bit more digestible to healthcare systems and wanting to continue to do the work and sponsor programs. Is there any potential for asking for more than 1.5% of the marijuana? Or are we sort of like encouraged to be capped at that 1.5%?
I don't know that I have advice on that. I think that's up for you all to discuss. Obviously, there's Department of Justice conversations that are still happening related to budget requests, and maybe Emily has more thoughts on that.
I don't right now, but I mean, that is kind of why I wanted to bring up this conversation, just so that we can look at it at the Department of Justice as a whole, right? Like we have to look at our entire department and what we're asking for. And you guys can bring this yourselves, and I think that's probably what'll end up happening. But we also want to make sure it's successful. So, I guess I think that's a conversation that we should continue to have.
Ben?
And I echo Emily on this one, well, both Emily's on it, with, from the administrative side, looking at the 600, it is tough from the administrative side that it doesn't cover the cost of the service and the program itself. And looking at the 1,000 per kit, it definitely gets it closer, but also knowing balancing programs is extremely tough. Going above what is already approved and looking at what is there, I think going and asking for column E and looking at it would be ideal to, you always shoot a little bit high knowing that you're probably not going to get it, but you might as well go and try to get what it's truly going to cost and then help out the programs. And if they're really wanting to get it established and have it meaningful, ask for what it's truly going to be and go for column E.
Thanks, Ben. Others? Brett Taylor, you're unmuted. Is that intentional? Did you have a comment?
No, it was accidental.
Other thoughts? Mark?
Is there any concern tying this to marijuana revenue if something were to happen and that revenue source is reduced a lot or something weird happens and marijuana is no longer legal?
I think it's a fair point if those things happened, in the legislature in reviewing that, would look at payment rates and how those funds are used and potentially recalculate. Mark, does that mean you'd have an appetite for proposing general fund money instead?
I'm just asking the question.
Anybody else have thoughts on that revenue source? Brett Taylor?
I mean, that was passed by the will of the people, right? So it would have to go back to initiative to overturn,
I don't know if
correct?
that's the
Unless it went to the Supreme
case.
Court.
Uh, I think the legislature can choose to amend it, even if it's adopted by initiative. Celine or Brett Irigoyen, can either of you clarify your understanding on that?
I am not entirely sure, but I do not think it has to go through an initiative process.
Yeah. My recollection is that the risk to the legislature was they could change it, but the risk was the ire of the public who had adopted it.
Yeah, I
Yeah,
just
that makes
wanted
sense.
to I just wanted to say I don't know that what the best funding source is. I think any requests from the general fund are going to be tough. Um, but at the same time, I think that there's probably a lot of legislation that's going to be proposed that's going to be trying to take pieces of that marijuana money. Um, I would hope maybe if we get in early, we'd have a better shot to get some of that. But I know that that seems to be a funding source that everybody's kind of looking to for various bits of legislation.
Also, I'm starting to feel it. I'm starting to feel like a broken record, but we are interested at the Department of Justice. We want to help you guys and kind of like if we have a suggestion to you on what the best funding source we think it might be, if it's the marijuana fund or the general fund, we want to work with you guys on that. Uh, it's just right now we're still so early in our legislative process that I can't really give good direction on that. But it is something that's on our mind, and this legislation is already on our like tracker for a better word, for lack of a better word, I guess. So we are willing to work with you guys and try and help figure out what could be most successful, what would be the best. Uh, but again, just like kind of early, but good to start having the conversations.
Emily. Well, with that in mind, how are folks feeling here? Do we want to keep moving forward with the proposals? Do you want to think about them some more and come back together in January or February? Do you want to workshop the language at all, particularly that minor consent? You had some suggested changes today. Do you want to revisit those briefly and just see if you're comfortable with those as you think about how to move forward? Celine?
Is not to push anything forward at all today. I think we need to sit with it. And Emily Cantrell, I don't know if you or Hope can comment on a timeline, or Suzanne, on when the administration might want our final proposal for your consideration, just so we have an idea how much time we have. But I think we need to look at this and think about it at least one more session before we go forward.
Yeah, I think for my purposes, sometime early next year would be fine. We're still having our preliminary meetings with all the divisions and other committees and such. So I can also keep you guys updated, like if we need something right away. But I think you're one of the earliest committees that I'm aware of that has been talking about this. So I think you have, you know, a couple of meetings at least before we would need something hard and fast. But also, I imagine that Suzanne and would want to talk about it with DCI as well, so that might change things a little bit.
Yeah, this is Suzanne. I haven't heard any specific firm dates or times on legislative asks at this point.
Like, if it helps give you any context, we also don't have any deadlines. We have DCI's like first preliminary top line proposal at this point, and that's it. So there's still time, and there's still a lot of conversations that need to be had on our end.
Emily, do you feel like if we came back together in, say, February, there might be more to report after the holidays and a little more percolation in January?
Yes, for sure.
How do folks feel about coming back together in February? Okay. And we could simply just bring these back as you saw them today or as you last discussed them today with those changes, those red lines I made as you were talking today to the minor consent piece. Okay.
Hope, would you be able to send out those updated versions that you kind of created today?
Sure. Any other information that folks would like to have as you percolate? Okay. We do have an opportunity on the agenda to take public comment on any matter within the committee's jurisdiction. And so let's go ahead and do that right now. I will remind the public, if you're attending today and you want to make comment on any other thing that was not on the agenda today, but still in the committee's jurisdiction, now is the time. Please click on the raise your hand button at the bottom of the screen. And we will call on you, ask you to identify yourself, and if you represent an organization other than yourself. Okay, no hands at this time. As we look at a February meeting date, does anybody have any no-go dates in February other than your usual days of the week that don't work with court schedules, et cetera?
I can't do Tuesdays. That's the
Mhm.
main law and motion day.
Yep.
Otherwise, I'm fairly.
Hope, I have court the second week of February. I think I'm subpoenaed for the whole week.
Okay, thanks, Jordan. Oh,
I
sorry, was that
have
June?
I have committee reports on Thursday mornings.
Thanks, Sue.
Oh, that was Jamie, not Jordan.
Thanks, Jamie. Sorry, Jordan. I should have looked up. The Zoom transcript will always save me. Well, typically.
It looks like we have a February 6th meeting. That's an hour and a half. Would it work with everyone to extend that instead of trying to find a new date? Just a
Brenda,
suggestion.
that's the nurse coordinator, the nurse meeting, their
Oh,
quarterly
sorry.
gathering.
You're right.
That's okay.
Okay.
Yep. Okay, well, I will look at dates in February. I appreciate those heads up on items. Any other conversation, discussion? We don't have any other agenda items that we're moving forward at this moment. Are there topics that you want me to be working on to bring forward to an upcoming meeting, or do you want to just stay focused on this right now?
I think this is a good focus as we work on refining these and getting them ready to move forward.
Okay. Anything else
I
for the
think
good of the
so as
order?
well.
Oh, yeah. Thanks, Brett. Okay, well, don't hesitate to reach out in the meantime if something comes to mind or if I can support you in any way. Appreciate your time today and hope you have a really great holiday season. Get some rest and relaxation and time doing something you love. And uh, I hope everybody has a sweater as great as Ben's at some point in your life because that's pretty awesome. Thanks for bringing the holiday spirit, Ben. We appreciate it. All right. Well, take care, everyone. Thank you so much for being here and for your time today. Have a good holidays.
Thank you, you too.
You too. Thanks,
Thanks.
sis.
Happy holidays.
Happy holidays.